My name is Alicia E, and this TED Talk is on somnambulism, commonly known as sleepwalking. Sleepwalking can be considered a disorder and is when someone is asleep but gets out of bed to do tasks, usually with their eyes open. You'll know if someone is sleepwalking when you try to talk to them but they don't answer and they'll seem very unaware. Here's some facts about sleepwalking. Sleepwalking happens in non-rapid eye movement sleep, and the sleepwalkers don't remember what they were doing when they were sleepwalking. Now, although sleepwalking can happen in adults, it's actually more common in children and can only happen a few times in someone's life or be chronic. In kids, it's more common in girls, and in adults, it's more common in men, with 3.9% in men and 3.1% in women. The sleepwalking itself can be as short as a few minutes or a bit longer. As for the tasks they can do, they usually do things that they can do by muscle memory, which include things like getting dressed, cooking, using the restroom. There's even been reports of, instead of sleepwalking, sleep running. That being said, sleepwalking can be really dangerous for the individual and for others. From walking downstairs, trying to walk out of the house, and even trying to drive a car. I personally have sleepwalked around the house a couple times, but I also know that back when my parents lived in a 2-story house, they had one of my pregnant family members staying over who was on the 2nd floor and, as you may have guessed, was a sleepwalker, and that night headed for the stairs when luckily my dad caught her just before she went down. And it's situations like those that can really cause people to have massive injuries. So sleepwalking is a serious matter, but some of the causes can be easily avoided. Some of the causes of sleepwalking can include things like the medications that the person is on. It can simply be from stress, from being sleep deprived, from drinking alcohol, from having a fever, or even genetics since it runs in families, but also from certain medical conditions like sleep apnea, GRD, anxiety and depression, and restless leg syndrome. The causes, but what are some of the treatments, you might ask? Well, most children outgrow sleepwalking and therefore won't need treatment. But if it's a common reoccurrence, then you can try things like hypnosis or short-acting tranquilizers in some cases. If you don't want to do that, and I don't blame you, there are also many simple preventative measures. To do this, you can make sure that your room is dark and quiet, try to go to bed and wake up around the same time, use the restroom before bed, and also refrain from liquids before bed, especially when it comes to caffeine and alcohol. Mainly just try to relax, since stress can be a contributor to sleepwalking. If there's really nothing you can do about the sleepwalking, then there are some preventative measures you can use, like having a door alarm so that you don't walk out, or gates in front of stairways for the same reason. Now for the most common question, should you wake a sleepwalker? No! If you do find a sleepwalker, then the best thing is to not wake them, but rather just steer them back to their bed. If you do come across a case where you really need to wake them, then the best thing that you can do is shout their name and try not to shake them awake. That's all for today, folks. Again, my name is Alicia E, and thank you for coming to my TED Talk.